On Wednesday, the 25th of June 2014, Ondo State was indeed privileged to host the leadership in the Bill and Melinda Gates Foundation led by Dr. Christopher Elias, President of the Global Development Program. Members of the team were in Ondo State to see for themselves the winning streaks of a state which won the maiden edition of the Immunization Leadership Challenge with the Ondo State Commissioner for Health, Dr. Dayo Adeyanju, as its guide. The team's first port of call was a comprehensive health center at Obaile in Akure North local government area, where a crowd of antenatal visitors welcomed them. The team was shown the workings of the center, the facilities on ground, as well as its well-structured immunization process linked with the central coaching store, as well as operational challenges. The next port of call was the Mother and Child Hospital Akure, a facility that prides itself as the busiest tertiary care institution in Nigeria, offering integrated and qualitative services for pregnant women, nursing mothers and children under 5 free of charge. The team also took time to interface with the operational staff and patients.
I've been very impressed by the dedication of the healthcare workers that we've seen. First at the health center we went to in Akure North, and then here at the MCH Hospital in Akure South. We've met many very hard-working health workers who are taking care of many women and children. We've been looking at how the immunization system works. You know that last year, Ondo State won the immunization award for this region of Nigeria. So we're interested in understanding how their immunization system works, and to see what we could learn from it for other states.
Next was a brief stopover at the Arakale Comprehensive Health Center, also in Akure, where the team was shown the workings of the smart cards known as Kadi Guiayo, conceptualized by the government to revolutionize profound services for pregnant women irrespective of location. The team then proceeded to the ultra-modern cold chain store at Okieda in Akure, where vaccines are centrally stored for the state for routine immunization and complemented with the new Primary Healthcare Board Secretariat to supervise and give meaningful direction to the bouquet of primary healthcare services.
This is our logo,
Sunshine.
Sunshine. This is in our own Yoruba language. It says, Ishe Logun Ishe. It means that hard work is the panacea to poverty. We are trying to engender the new spirit of dignity of labor here. And I can tell you that this is already catching up.
Next was the interface with the state governor, Dr. Olusegun Mimiko, where both parties harped on the need to deepen the relationship between the state government and the Bill and Melinda Gates Foundation. Interestingly, the team's visit coincided with the state's task force on polio's meeting, and the team was delighted to be part of the meeting.
At the Bill and Melinda Gates Foundation, many of the programs that we're supporting around the world depend on a strong and effective primary healthcare system. We have a very strong interest, as you know, in supporting immunization systems and using those as the strong foundation for the eradication of polio. We've been following the progress of Ondo State for some time, since we recognized you as the winner of the National Immunization Award last year.
To impact the socio-economic life of our people, we see primary healthcare as something beyond healthcare, because we are clear in our mind that healthcare has a multiplier effect on the economy. So for us, primary healthcare is a tool that we deliberately employ to reach our people, especially at the grassroots level. We believe that if we deploy efficient primary healthcare system and put in place a very seamless referral system and improve on information dissemination, and we're able to track our performance, we're going to be able impact the lives of our people.
With souvenirs and chocolates from the state's cocoa plantation farm as a thank you visit, as the thank you for coming gifts, it was time to say goodbye to the Sunshine State after about 5 hours of hectic but rewarding visits.
It's unfortunate that I have such a brief time in Ondo, but it was important to me and to our delegation to have the time to visit Ondo, to learn about some of the innovations and the hard work that you've all been doing that led to your winning the National Immunization Award in 2012. A lot of what we do at the Melinda Gates Foundation is work with countries to achieve important, ambitious goals, most of which are dependent on a strong primary healthcare system.